very warm welcome, everyone. I'm Sharon Bly. I lead health and sustainability here at the Consumer Goods Forum, and I have the immense pleasure and honour to be surrounded by such an exceptional panel of experts, all working to drive well-being in their workplace and for the entire consumer goods sector. So you're very welcome if you're joining us live here today, or you're listening to this session in the future. I hope that you will get lots of takeaways, inspiration, and insights for you to continue to drive this very important topic within your organization. We are joined today with Laura from Barilla, Mathilde from Danone, Bilger from Migros Ticaret, Greg from Pepsico, Sunita at Unilever, and Lisa from Walmart. And on top of their daily responsibilities, they're also members of the Consumer Goods Forum Global Employee Health and Wellbeing Working Group, who are at the center of building and overseeing the strategy of putting people at the center and at the core of the agendas of all of the members of the Consumer Goods Forum. So we employ about 10 million people in the 400 members of our organization, and about 90 million people along supply chains in 70 countries all around the world. So we hope that this will have some impact on looking after all of the people that work for this fabulous industry and their families. So if we look at today's session, on the next slide, you will see here on your screen, this is the antitrust caution statement. When you think about questions that you may have for our fabulous expert panel, please do respect the antitrust caution statement. And this is something that we respect and use across all CGF webinars and knowledge sessions. So just to set the context before we get into today's content, Employee Health and Wellbeing sits within our Collaboration for Healthier Lives Coalition of Action, which is one of 9 coalitions of action at the Consumer Goods Forum. And the co-chairs of the Consumer Goods Forum have created acceleration areas. And you can see here on the next slide, these are 5 areas that we're really looking to build implementation, awareness, adoption, and impact across these 5 areas right up until 2025, and establishing employee health and wellbeing programs and supporting the membership around the implementation and the establishment of those programs is something that we have taken on board as a coalition and as a work stream. So what we wanted to do today with the speakers is really look at some of the kind of key and pressing questions that we have around employee health and well-being. Of course, last month we had World Mental Health Day, so we know that this is top of mind for organizations and companies at the forum, but it's an evolving concept and its evolving space. So I'm going to go first to Greg and Mathilde, and we're going to kick off by looking at the concept of employee health and well-being, how that has evolved in recent years, and if you could share some of the trends that you're seeing in your organization and you want to share with others. So Greg, maybe you can kick us off, and then Mathilde, we'll come to you.
So, I mean, in terms of trends, I was thinking a little bit, going back to where were we in well-being, 10 to 15 years ago, and talking a little bit about the evolution we've seen at PepsiCo and in the broader market. But because I was thinking, 10, 15 years ago, we didn't call it well-being, we called it wellness, right? And at Pepsi, and I think most organizations, wellness was focused more on, physical well-being. It was really focused on step competitions, wellness fairs, vaccination campaigns, those types of things. And again, don't want to go too deep into the history lesson, but we didn't even have a full-time employee doing wellness before 2010. When we finally set up that wellness team, it was separate and siloed from our health team. The other thing that I would say is I was with Pepsi, living and working in Dubai, 2009 to 2013, and there was huge inconsistency in wellness programming. So what I was seeing in the Middle East and Asia was very different from my experience with wellness in the US. So fast forward to 2024, and I think where we're headed, we now call it well-being, but I think well-being is a much broader concept. First of all, the physical well-being is still the foundation, but I think most organizations have a much more holistic view of employee well-being that pulls in emotional well-being, financial well-being, social. I had a nice quote. I was looking at a deck we'd shared. This is an internal deck within PepsiCo, but I thought, this kind of summed up well. Well-being focuses on overall quality of life and the employee's entire experience, not just physical health. And that sort of, I think, sums up how it's brought into a more holistic perspective. And a few more quick thoughts, and then I'll hand off to others. But well-being, as we think about it, it's more holistic. It's more integrated into into HR. It's fully integrated into our total rewards offering. We're kind of talk to our DE&I and EH&S people all the time. It's called out on our company EVP. If you go to the website, there's a whole page on employee well-being. It's something that our senior leaders care deeply about. They view it as critical to the EVP. And as I said, we're talking about it all the time in an integrated way. And I think the final thought I have is we have global frameworks now. We have a handful of global vendors, but we have a global technology backbone for managing wellness programming around the world. And because of that, there's just much more global consistency. I think if you were to go to India or China or Brazil today, there still is some local customization within our global well-being framework, but there also is a lot of consistency around programming and financial well-being, mental health and emotional well-being. So I think we've come a long way, and that connectivity is just going to continue. So anyway, I'll hand it off. But it's a great place to start, I think.
Brilliant. Thanks, Greg. Mathilde, your builds on that.
Yes, sure. Well, first, hi, Sharon. Hi, everyone. Thank you so much for creating this space for us to collaborate with peers and exchange best practices in order to accelerate the well-being topic. So, as you mentioned earlier, Sharon, I guess well-being is really an ever-evolving concept. Greg, you mentioned you're working hand in hand with many different HR teams. I myself leading DEI, diversity, equity, inclusion, and well-being, and we consider it absolutely intertwined. If I were to think about the evolution of employees' well-being, I think it's of course impacted by many macro themes that we see around us in a post-pandemic area, the high rise in medical costs, economic headwinds, public health changes, for example, and many others like the increasing number of non-communicable diseases, for example, cancer, diabetes, just to name a few. And over the past years, I would say the employees' well-being has really shifted from being a nice to have to being a must. Greg just said earlier, it's part of the EVP at Pepsico. I guess it's the case for most of us. And really, when you look at research, it really shows that well-being is now ranked as top priorities for companies in the next 5 years. And it has really risen in terms of importance and also in terms of prioritization. So in my opinion, there are two main recent evolutions. I totally agree to them with Greg on the holistic lens, so I won't go back to this one. And I think it really has become a true business topic. And that the business case is very clear, and that it has become really an increasing core component of organizational culture. And now we know, and it's really recognized that the greater the employees' health and well-being, and really the greater business performance, engagement, motivations, and etc. So in terms of the latest trends, to go back also to your initial question, Sharon, I would say there is an increased focus on creating really targeted and tailor-made services in response to specific needs at key moments of life. We may not have the same needs when we are in our early career, or when we're caregiver, when we're a senior employee. And at Danone, this is really something we are looking into, especially in keeping with our mission of bringing health through food to as many people as possible. We consider this mission really starts with our own employees. And that's why regarding different key moments of life can be breastfeeding, can be the first 1,000 days of, can be diseases, for example, cancer, really leveraging our internal expertise and linking it to our portfolio, and either giving some nutrition education, for example, for our employees for their own health and benefits. The second thing I would mention maybe is technology integration. We use we have a global app application to encourage holistic well-being. And maybe the last trend is a renewed focus on mental health. This is no new news, but especially with the younger generation, especially Gen Z, there is really an increasing importance of the topic, and this is also about attracting the best talent, because at the end of the day, a lot of employees, and not only the younger generation, that are making no compromise on their own well-being and also on the stance of companies on the topic. And this is also to support all employees, but also it goes beyond their families and our communities.
Brilliant, thank you. So it really is an evolving space, a must for every organization, and that kind of holistic overview in itself brings challenges to the implementation. So maybe I'd love to get Laura, Bilge and Sunita, your kind of take on what are the most pressing challenges that you're facing bringing this into your organization now that the business case is there, it's clear, the expectations as well have risen. So yeah, what are the most pressing challenges? Laura, do you want to kick off with that one?
Sure. Thank you. Thank you, Sharon. Thank you to the Consumer Goods Forum and to the esteemed panelists. I'm excited to learn with you all today. I'm joining you from Montreal. And I would say the most pressing challenge for us isn't so much the customization, it's more exactly what was just mentioned by Mathilde on terms of how do you do programmatic work across many markets, but make it so customized that it reaches the employee with just what they need, just when they need it. You're looking from manufacturing to office workers. And I'm going to help represent all of the mid-sized companies or even small companies who have limited budgets. Greg mentioned his first dedicated resource in 2010. What if you don't have dedicated resources? How can you still do this work and find ways to do it so that it's customized, targeted just for them, just when they need it, on limited budget and with limited resources? I think that is probably one of our biggest challenges that we're facing.
Thank you, Laura. Bilge, do you want to come in on this one?
Thank you for this opportunity for us to share our experiences about health and well-being. Actually, I would like to answer this question from the perspective of Migros, which is maybe there are some audiences they don't know about the Migros, which is Turkey's one of the widespread and large retail company. We have approximately 75,000 employees and 3,000 stores in all 81 provinces of Turkey. While working on the health and well-being of all our employees, which we carry out our work by gathering the challenges and encounter 5 dimensions, which are health, psychological well-being, positive work environment, motivation, and financial awareness. While carrying out our works, first and the biggest challenge we face is the geographical spread of our stores and the fact that providing services in different locations far from the center of the cities to our employees. Therefore, our primary goal is to ensure that our employees are not left disadvantaged due to their position or region, and the opportunities provided to our employees are most of all fair and accessible. It is difficult to provide all employees the same opportunities, but we are trying our best. For this reason, we have worked to provide this, first of all, provide the same quality and healthy meals to all our employees for a long time. And we have invested in a food company, which is another challenge for us, which is prepares prepacked nutrition balanced meals in the hygienic packages. Now we are currently serving them in our pilot regions and working on to deliver all over the country, which is difficult. And the size of our company and the ecosystem we are in with large number of employees from different age groups and educational levels poses other challenges. The sustainability of our company and this large ecosystem is only possible if our employees are healthy and in well-being state. Raising awareness at all levels in the company is a challenge in itself. The basis of all our work is, first of all, make sure the employees are aware of the importance of health and well-being at workplace for themselves, and that there are services needed and provided by the company, and encourage all employees to benefit from the services provided, because the employees' needs are changing, that as Mathilde mentioned before. And another important challenge encountered, especially during periods of financial uncertainty due to different life concerns in different regions of the world, it's changing. And while it's changing, the choices of the employees are changing. The priorities of the employees also differ from each other, depending on expectations from their working life. As a company, it is difficult to find different choices suitable to different employees. When some employees struggles with financial difficulties for different reasons, some employees find difficult to manage stress and managing emotions at work and managing mental health due to different pressures they face. Therefore, we are providing our employees with flexible benefit platform, which they can choose the benefits for different benefits of their choice or needs. For example, if they need health insurance with affordable prices, we are providing gift vouchers from different suppliers. On the other hand, some of our employees want to engage in volunteering activities to benefit the society they are in. And as a company, we will support them with our volunteering platform soon. We are trying to provide. And the last and biggest challenge I would like to mention is difficulty of changing the mindsets and the habits of employees. For this reason, willingness, support, and the ownership of all units of the company is needed for employee health and well-being programs to be able to change the culture and to reach the successful results. So, while talking about the employee health and well-being, the different needs and changing environment is really important to have a look, and the biggest challenge, I believe.
Brilliant. Thank you, Bilge, for sharing the challenges you're facing and the strategies that you've put in place across the 5 dimensions at Migros. Sunita, let's come to you and what that looks like at Unilever and what you feel are the most pressing things that are on your plate at the moment.
Thanks, Sharon. And I think it's good to go after everyone else, because I think between Greg and Mathilde and Laura and Bill, we've heard a lot about overall what's the trends and what's going on within challenges. Let me try and summarize that a bit and then add what we are seeing as well, right? I believe the difficulties or the challenges are in 3 areas. There's the people, process, and platforms. I think enough has been said about platforms, right? The lack of availability, insufficient resources. Let's take the example of mental health. Not enough experts, no access to psychologists in some parts of the world, right? Where the stigma is deep, but also the lack of access and care and equitable care that will be of the standard that as multinationals we want to provide. With this large and vast geographic and demographic spread, platforms will be one key issue that we're not able to circumvent. We just can't find the vendors and partners that can serve us everywhere to offer standardized, institutionalized services. But the first 2 that I talked about, people and process, that's where I think the challenges are really huge. Within people, is the stigma within the people themselves, the individual facing stigma, in looking for downtime, always on cultures, the idea that you've got to be, many things, several things everywhere, the way you're seen as successful, social media portrays you as successful if you've got different attributes that you're, sort of demonstrating success. And so with people, the discrimination, the fear of discrimination, the fear of judgment when you want time for yourself can lead to holding back until we are able to prove to the business that, in fact, caring for well-being, we already know the data. Indeed, in Oxford have done this beautiful study which shows the strong correlation between profits and offering employees the opportunity to care of their well-being. Still, we're able to show the workforce productivity is positively impacted with well-being initiatives. It's always going to be a challenge. So we won't get the sponsorship from the leaders. We won't get the participation from the individuals themselves. And in the workplace environment, the way we talk about caring for your own well-being or self-care has to change, right? Only then will the processes change, then the policies and procedures will change. But the gap continues to be within people because we portray caring for our well-being or wanting downtime, or we portray mental ill health as deep, dark spaces. And we start talking and discriminating and distinguishing people. And that's a reality we have to face. And I don't mean this only for Unilever. I mean this across industry, right? We've been doing this work for a number of years. Greg talked about the last 14, 15 years. This is when we've been doing this work. And while there's some positive stuff out there, like peers wanting to help one another, getting trained and equipped, the mental barriers that people face in caring for themselves are always going to be primary in my head. So organizations will always face challenges in finding solutions that are progressively meeting the varied demands of people. And then the process and the platforms will continue to evolve as we see time go by.
Brilliant. Thank you, Sunita. So we just put in the chat a link to principles of well-being that we co-created as a global group with the McKinsey Health Institute. And in those principles, one of the areas that really flowed through was the importance of culture and value that support well-being. So Sunita, let's stay with you, and just if you could comment on culture and values and that importance. And Laura and Mathilde, if you would come in on that question as well. We've seen how important that is to really make sure that this is embedded and lives and breathes in an organization. So Sunita, we'll stay with you on culture.
Yeah, I started to talk about that really a little bit when I was talking about processes and policies and procedures. You can have the best of policies, but when there are cultural inhibitors, right? When there is line managers or peers lack the skills to understand what's going on with individuals, when you start to miss the signs and symptoms of declining mental health, for example, when the conversations of the coffee machine are dismissive of the performance potential of someone who is struggling with their well-being, that's when we start to see a very big disservice happen, right? So it's not what's happening within policies and procedures, it's what's happening within the people, right? The way you're interacting with one another, the way you deal with those moments of truth. It's really, really important for leaders to step up and see, become more self-aware of where they lack sort of comfort with dealing with the different challenges that come. This whole proverbial conversation around multi-generational workforce and how we need to work with younger generations differently. They're far more vocal about their mental health. They're far more vocal about their well-being needs. They will seek all of that. I think it's important for us to also acknowledge that, yes, there are differences, but the leaders hold the pen on how they influence positive role modeling, how they do the storytelling, how they share their own vulnerabilities, and they make it possible for people to not just negotiate, but have access to the support that they need to care for their well-being, the support that they need to improve their mental health. So I think it's a shared responsibility, it's a collective responsibility. And unless the business is able to see the benefit of investing in well-being, this will continue to be a challenge. So leaders, role model, storytell, line managers along the way, adapt, learn new skills, build sensitivity, and individuals feel psychologically safe enough to speak up and share what's going on with them. When all of those are in congruence, we'll find the cultural inhibition starting to shift a bit.
Brilliant. Thank you, Sunita. Laura, do you want to build on that?
Yeah, I think for us, everybody does a survey, so that hasn't been mentioned yet. So I just want to make sure, when you think about culture and workplace and where to start, look at your survey, take that as an input to find out what people are focused on. For us, and you can see the slide that was brought up, it's all the things that were mentioned before, but what was really under that was a challenge to our culture was time. And leaders said, look, we love all this. We want to do this. We just don't have time. And so how can we bring to life in a way that supports well-being and helps leaders build skills when they're so time challenged? And something very practical that we did was we focused on 15 minutes. You think about, when was the last time you had a 15-minute meeting? We started to do something called bites. We wanted to make sure it was really linked to the business strategy. And when you're in food, CPG, it's a little bit easier to link well-being to the business strategy than maybe other industry, but link it to the business strategy, and more importantly, break it down into something very practical, tactical that they can do in 15 minutes, and give them tips. And we did this around our finance piece, so just helping them make sure that they were maximizing their pension, their savings, making sure that they thought about moving in the day, actually doing a moving exercise or a challenge. I know Greg mentioned that at the top of the call. We just had to get back to the basics with some things we knew that worked, but broke it down in something that was very approachable and that could be worked into their everyday lives. And so that was one of the things we did to weave it into our culture.
Thank you, Laura, for those insights and the importance of surveys and understanding the needs. Mathilde, culture at Danone, what does that look like?
Yeah, well, just like taking a step back, I'm just reflecting, like, to effectively support employees' well-being. Of course, organizational culture that promotes well-being and efficient work environment in general is key, but indeed the most important differentiator factor are really the leaders and the team leaders. Just before, Sunita, you mentioned the line managers, and I would like really to double down on this when we know really the impact that they have on their own team. Like, research show it that around 70% of employee say that a team leader really has the greatest impact on their mental health, same as partners and spouse, more than doctors and therapists. And when it comes to hybrid employees, I think it's 60%. I said that their team leader is the most influential person they interact with in terms of connecting with their company's culture. So it's really big. The figures speak for themselves. And at Danone, we are substantiating this research with also data, also based on a survey that we do every year, actually, to really analyze the impact of leadership on employees' well-being. And we have a different set of questions and different indexes. And we have one that is called My Manager Index. And when we look at the correlation with my only well-being index, it's extraordinary high correlation. And what we do, of course, respecting confidentiality thresholds and anonymity, is that for the largest team, we actually give the results directly to each manager regarding their own manager index, really to help action plans at the team level. So that's one thing that we do. But when we think about your initial question of how we can, as leaders and team leaders, create a workplace that values and support well-being, I think it has a lot to do first with ways of working, things that have been already mentioned, and things that may not be directly linked when we think of them, like to well-being, like having clear objective, eliminating obstacles, but also normalizing the conversation about well-being. For example, what we've been doing at Danone, my team and the talent management team, we've been really working on having some guidelines just for every, like, regular one-on-one that you may have with your boss, to really integrate a kind of well-being check-in with some very practical tools, so that we make sure it's part of our culture, it's part of things we do, like, on a regular basis. We also do, like, some piloting with many team leaders around ways of working, and through these pilots we've introduced, for example, practices like focus work, like no meeting slots, for example, on different slots of the day, to encourage really deep work, reducing meeting durations, in some teams no Friday meetings, etc., etc. And it's always the leader or the team leader that really sets the tone. So what we do is we really try to put the leaders and team leaders in the driving seat. Training has already been mentioned by Sunita. This is something really key for us to upskill really leaders and team leaders on the topic, be it on well-being, on preventing burnout, on identifying weak signals, for example. but also really empowering them to recognize when it kind of goes beyond their own scope, recognizing their limitations sometime, and whenever it exceeds the support they can provide, just establishing and reminding everyone of the clear protocols or where to escalate and where to look for professional help. And yeah, just to conclude, leading by example, also taking care of their own well-being. If top leaders, us as team leaders, we really show the way in taking care of our own well-being and work-life balance, it will also help break the stigma on many topics and really foster a supportive environment.
Brilliant. Thank you so much for sharing, all of you, the how you're empowering leaders, and not just at the top, but all the way through the organization to really live and breathe that culture. So it was mentioned at the start of the session just how things have evolved, and just how mental health was something that maybe was not forefront of all of our agendas, and something that all organizations are working with and dealing with at the moment. So Lisa and Greg, can we really kind of deep dive now into some of the strategies that you're using at Walmart and PepsiCo on addressing mental health in the workplace? Lisa, let's start with you.
Okay, sounds good. So thank you very much, Sharon. I'm really excited to share our perspectives and how we think about things. I think initially it's really important, just as background, within the US, the Centers of Disease Control and Prevention, what they have shared with us in the country is that 1 in 5 adults are living with mental illness. And it is clear that all of us, at one point, we experience stress, anxiety, grief. And so all of us at one time or another are faced and challenged from a mental health perspective. And so I'd like to share a couple of the resources that we have put together for our associates. And I'm hoping you can see this. Okay, perfect. And so what I'd like to start off by sharing is we are really trying to meet our associates where they are. From a strategic perspective, we're really, trying to make benefits available so there's no barriers. And we're really thinking about how do we connect with associates with different programs. And what is very clear to us, we have all generations. So what someone had mentioned, Generation X, but we see as much utilization and concerns in the millennials, and don't forget about Gen X, and then there's the baby boomers. And so we see it across all of our associates. What I wanted to mention to you today is a couple programs that we have available. And one thing that we're very proud about is we offer benefits available day one. So the day that you're hired, you have access to 20 no-cost mental health therapy coaching sessions. And it is per person per year. And it is for our associate and their family members. And we have had associates that have come to work for us. And when they learn about this day one, they have utilized and really have just flourished as an associate. And so we feel very confident that putting this in place has been really good for our associates and their families. We have digital tools available. It's 24/7. One of the tools that we offer to our associates is peer chatting. So being able to chat and with your peers, I think is really, associates find it very beneficial. And so what we've done there is we've just added recently Spanish, which is a big additional language within the US. So we're really trying to accommodate as many associates as we can. Associates that enroll in our medical plan, they also have access to virtual mental health care. It's at no cost. So all of our mental health programs are at no cost to our associates. And that's our commitment, really to show that we really care about our associates. Someone had mentioned about the concerns about having access to care. And there are areas in this country that we don't have access to care. And so that is why virtual really has worked out really well for our associates. We also have a program in place through data. We're analyzing, and a company is reaching out to our associates that may need some help based on some of the data that comes back. And so they proactively reach out. And what you learn about mental health is it is very difficult to pick up the phone if you're struggling from a mental health perspective. A lot of times you may not even realize that you're struggling. And so we have this partnership with a group that actually reaches out to our associates. We just, in the last month, it says 29 states here, but we just rolled it out to the whole country. We also have added a feature called Help Now, where associates can call in if they realize that they're struggling. So that has been a great program for us as well. Last thing I would mention is our commitment to training our frontline leadership and campus leaders, focused on what should you be looking for and how do you connect with associates to see, is something different, or are they not coming to work every Monday? Are you asking associates why? We have something at Walmart called Coaching by Walking Around. And that is our leaders going around and connecting with all of our associates. And this program really required our leadership to go through, understand that you're not the experts, but we have experts available. And how do you point to those experts? And so there's a whole lot more that I could share, but those are the key points today.
Brilliant. Thank you so much for sharing all of the tools and the resources that you have available to all of your associates. Greg, do you want to build on the mental health?
Yeah, no, thank you. And no, I mean, that's great stuff. Lisa and I have spoken before, and I mean, Walmart's really, doing some cutting edge work supporting associates. But it was interesting, Lisa quoted that CDC research, and I mean, building on that, looking at our workforce within PepsiCo, we do a lot of sensing through health assessments and other tools, and I think we take a broader definition of distress. Looking at employees who report stress, anxiety, burnout, depression, and pre-COVID, it was 1 in 5. Today, it's closer to 1 in 3 employees. So it's really pervasive and touching. If an employee isn't doesn't have some degree of mental stress, someone on their team likely does, or a family member. So it's I think we're feeling like it's as we think about this, we've been building a suite of tools to address it in as holistic a manner as possible. And so if I have this sharing done properly, we'd done a case study, and it's high level, but it's available through CGF. And if folks have questions, I'm happy to pick it up offline. But the one thing to highlight on the cover is we try to have a consistent global approach to how we think about mental health, and historically we branded wellness under healthy living, and as we expanded it, mental health was an important enough topic that we gave it its own brand. So if healthy living as the high level, healthy mind was really the mental health side. We also have healthy money, and we've tried to have branding for the important global pillars, and I'll keep things high level, and folks can find the case study. But if folks can see the graphic, what I wanted to do was just quickly talk about the framework that we apply globally when we're thinking about mental health, and similar to probably every organization on this call, right? If we start on the upper left-hand side, in-person mental health care. Historically, the approach has been, providing in-person resources through the medical plans, in some countries NHS or other statutory provisions. I think as Unilever was highlighting, access to care is a huge issue. In the United States, it could be a 4 to 6 week wait to talk to somebody in person. So we've been building out, virtual mental health capabilities, similar, I think similar to what Walmart's doing. So employees can get access to, pools of virtual therapists. Typically it's within one day, and that's been a huge unlock. Just huge take up, and it's been very well received. But as we've been kind of building out our approach and suite of tools, I think what we've realized is we need more than just access to therapy and access to direct traditional mental health resources. So one tool we've built out is a resilience and stress management training, and that's we're working with the vendor. They've translated it. I think we're in 13 languages now, so it's a global tool, and it's really focused on building coping mechanisms. So, and that helps that kind of next level down. So maybe a manager or even an employee who doesn't quite need therapy but just needs coping tools. And we did a really nice. We partnered with our chief medical officer who did a lot of kind of global promotion of those tools and resources, and that's really helped us get utilization up. We saw it from sort of a small secondary part of the offer to one where we literally have tens of thousands of people logging in and using the tools. I think again, like Walmart, what we call the mental health support network. Some organizations call that the mental health first aiders. We brand it as mental health allies, but that's training. We want to make sure, like in every plant, there's an HR business partner who's got those kind of tools to help identify employees in stress and help them develop those tools. Financial well-being, again, every time we do employees sensing, we find that one of the top 3 stresses, no matter what country you're in, one of the top 3 stresses is financial. So this is newer, but in the last year or two, we've really been trying to build connectivity between our Healthy Mind and Healthy Money programs. And if our virtual therapists hear people talking about money stresses, they say, "Oh, did you know we have Healthy Money counselors who can help you build a budget, help build financial literacy, help," and that's been appreciated. And the final piece is just education. Every year, I think where we started with Sharon, right? We do broad global activation on World Mental Health Week. So there's a lot of global programming through the year, but that's sort of the capstone. And we had something like 35,000 employees participate in programming last month. So anyway, I could talk for half an hour about this, but that's the framework. And as I said, if anybody has questions, I'm happy to pick it up in another forum or offline.
Brilliant. Thank you, Greg. And we've put the link to your case study in the chat, and we've multiple case studies available on our website. And you've all touched on kind of tools and resources and just the reality of getting that to the people in your organizations. You all work with stores, distribution centers, factories. Lisa, maybe you can comment on the technology that maybe you use to really reach people at scale, and kind of what does that look like at Walmart? And Bilge, if you want to comment on that, just on the technology piece and what you're using and what you're finding that's effective. Lisa.
Yeah, love that. It's Greg, it's so interesting because I was thinking about when you were saying, financial and mental health, it's amazing the interdependencies that we see between physical, emotional, mental health, and financial, and how important it is to focus on all those key pieces from a well-being perspective. From a technology perspective, getting the word out, connecting with your employees or your associates is probably one of the most difficult things to do, to bring awareness. And really, when do you connect with them? When it matters most, right? We have 1.6 million associates in the country of the US. And the majority are in the stores, they're in supply chain facilities, they're in roles where they're not in front of a computer. And so we have really been focused on how do we enhance our digital tools, and what can we offer so our associates are aware of the benefits that we're offering. And so a few years ago, we gave about 740,000 associates mobile phones. And in those mobile phones is what we call a super app. And it is called Me at Walmart or Me at Sam's Club. And it is an environment where associates can go into the Me at, and there is a section specifically for benefits. And so they can find information within seconds, as opposed to having to go to the computer, navigate, dig for content. It's right there, within their hands. And I think we've all become very accustomed to using these little phones. So we're continuing to invest. Our associates, I think, really appreciate the Me at tools that we have provided. Mental health is one of the areas that we do highlight in the tools, and it takes you directly. You can automatically call to our resources. So we are really trying to make it easier for our associates to connect to their resources. But we continue to invest, right? And we're trying to figure out how do we continue to break down those barriers so we can connect our associates to those offerings. And so, more to come, I'm sure, as things evolve, and very much appreciate the opportunity to share with you today.
Thank you, Lisa. Bilge, do you want to comment on what that looks like at Migros in similar scenario where your people are not in front of computers and phones all day long? What does it look like at Migros?
Actually, with the time pressure, I will keep it short. But technologies helps the organizations to create more engaging and personalized well-being programs, I believe. As we mentioned before, traditionally, all employee wellness programs focused on physical health. But these days, modern wellness initiatives encompass mental, emotional, spiritual, and financial health, which is supported by innovative platforms. They provide an integrated approach to health and well-being. In this context, technology plays a crucial role to provide personalized health programs, mental health, sport, and accessible resources, regardless of the location. And also ensuring inclusivity and equal opportunities for all employees. As Lisa mentioned, we all have mobile phones, and every employee has the mobile phones. With these technological devices, we can reach our employees wherever they are and whenever they wish for. And I would like to mention about the online trainings and the gamification platforms that we see the results, satisfactory results, that these kind of platforms promote a supportive community among the co-workers, and which play a vital role in stress relief and the communication. They connect with these kind of platforms. With the Retail Academy, we have the online trainings, all now using the gamification tools, and the results are, as I mentioned, satisfactory for the company and the employees, especially with the help of AI-based tools. A lot of manual tasks have been reduced, which is saving some time and resources for the company, and the employees can focus on highly valued activities and the critical thinking, minimizing their error, reduce operational costs, and also reducing the stress. And technology enhances the productivity by reducing the stress and providing support for personal and professional challenges when they needed by the employee. And also there are lots of employee wellness platforms and applications within lots of organizations. These platforms offering a range of tools from the mental health, the nutritional guidance, stress management techniques, and more. And this, in the era we are in, companies equipped with the right technology will not only see the enhanced productivity, I would like to mention, but will also be able to build a stronger and more resilient workforce capable of thriving in ever-evolving corporate landscape. And last of all, I would also like to say that it is promising, as we can see from this panel, that for employee health and well-being professionals to witness more and more organizations, more and more companies, managers, leaders are willing to use technology to its fullest to maintain employee well-being, which we all will benefit.
Thank you, Bilge. And I see that there's a question in the chat around platforms and technologies that we're using. This is something I think we'll follow up and we'll maybe put on our website some of the tools and resources that have been mentioned. And so I've just two more questions. So I'd love to come to Laura and Sunita with the next one on looking after your own well-being, and Matilda, then if you can comment on measuring everything that we've been speaking about today and the effectiveness of measuring. So Laura and Sunita, do you want to comment on looking after your own well-being and how employees can play a role in taking ownership of their own well-being as well?
Yeah, I mean, I think the worst thing we could do is have great technology, build beautiful platforms, have beautiful campaigns, do all of this research-based work if no one takes advantage of it. And what we have found is like there's one or two difference makers. One is the leader role modeling. Are they storytelling? Are they telling their story about their struggle with their own mental health? Are they talking about it in town halls? I know for me, I do a lot of walking meetings. I want to get my exercise in. I want to walk. And so my team knows, and they'll actually ask me, hey, can I have your walking meeting time? And they know that we're not going to show slides. We're not looking at Excel files. So we try to do that, but you really have to role model as a leader. And something that hasn't been mentioned yet today, but I just challenge each of you, what is on your development plan, your personal one? And are you talking about that with your teams? I think Matilda talked about the frontline supervisor, like make it where the supervisors talk about what's on their development plan with their teams so that they know that it's safe and that they're working on this too. This isn't something they're doing to their employees or for their employees, like they're working on it in their own way, whatever their well-being priority is. And I just find that when you role model, employees really respond better to that authenticity. And then they're going to go check out the cool tools and the technology.
Great, thank you. Sunita.
Let me pick on two areas that I want to talk about. First of all, as leaders, we need to actually walk the talk, right? So let me take two examples of what I do. One is I'm, a runner, passionate runner, and I talk about it all the time. So I'm taking care of my own fitness, and even as I talk to others about it, I think it's a great talking point, right? When you can experience the positive outcome of good well-being, you eat right and everything, which doesn't mean you don't eat pizzas and the things you like, but it's just about walking the talk, right? Demonstrating it. I think the other one is in the psychological safety space. That's a space we've invested a lot in. And, when we don't share our own vulnerabilities, or if we don't challenge stereotypes, harmful stereotypes, right? When someone's saying something that's harmful to the cause of well-being, I think it's important for us to take that step and address that head on. Just show by example. Every single program that we run, I've always participated in it. I've encouraged most of my leadership team members to lead from the front, to talk about their vulnerabilities, to participate in the programs. We run mindfulness, we participate in it. We run psychological safety, we make sure we are doing it first. So I think having a good dose of our medicine, and I really want to address one key problem everyone talks about, which is time. It's never about time. We do prioritize the things we care about. So prioritizing walking the talk, I think, is a great way to build large number of adopters within the system. Thanks.
Great. Thank you, Sunita. And thank you, everyone who's taken 1 hour of your time to listen to all of these insights today. So we're coming to the end. We just have a couple of minutes left. We've spoken a lot about holistic health. And Matilda, I'd love to end with you on measurement. We do have within our coalition Workforce Nutrition Alliance, where we have a very comprehensive and dedicated scorecard on measuring workforce nutrition. What does that look like if you look at really measuring the effectiveness of your holistic well-being approach, and any insights you can share with everyone listening?
Well, thanks for the question, because I guess it's a very crucial one indeed. And while the ultimate goal is really to have a thriving and engaged workforce, when we look at the measurement and the effectiveness and the impact of our well-being initiatives, sometimes it's easier said than done, because what we want to look at is really output KPIs, at what is the impact of what we're actually doing, not only the reach of our initiatives. And sometimes we know when it comes to employees' well-being, it can be multifactorial in many cases. So this is not an easy task, but yet what gets measured gets done, as we know. And sometimes also when it comes to health, especially, it can be a long-term measurement. Say that you implement some specific health checkup in all your warehouses, for example, or plants or stores in some cases for you. Well, it can take time. So how can we do that, and what can be effective ways of measuring? The first thing, I guess, we already touched base on, is really through monitoring employees' perception. So through surveys, through per survey, really taking the pulse of the level of stress, the level of energy, linking it to the intention to stay, linking it to the sense of accomplishment, and also asking about the impact of any initiatives we've been running. That's the first one. The second one will be around health metrics. What about the health checkups that you're actually possibly running? Is there, because it's one thing to offer it, and we know, especially we had a lot of example from the US. I think it's a great benefits, but it's another thing actually how people use it and how people actually show up to this health screening, for example. So it's even better if we can provide time actually for employees to actually do them. On top of health metrics, there are, of course, productivity and HR metrics like retention rate, attrition rates, absenteeism, because we know for sure at Danone, but also research backing up, that thriving people and thriving employees are more likely to stay. And this is where it absolutely impacts also the P&L, of course, of employees. So that's why at Danone, we're trying really to work proactively on health and well-being, and through some prevention plan, and we're assessing like globally, but also at country level, like all the medical claims and data that we have, to identify the major medical claims and create targeted and holistic benefits plan to really try and go to the root cause of all the issues that we may have right now. And we're also trying to go through towards a more predictive analysis, taking into consideration all the data I mentioned, like HR metrics, but also health, but also perception, to really try and identify critical CBUs or team or department where there may be any hot topic. So all in all, measuring all of this is absolutely key. It needs also to be measured for all employees, and this is sometimes a challenge. So that's why we're looking at it very carefully. But on top of all of these quantitative measures, we also need to think about it more broadly. We talk about psychological safety. This is not maybe something that you can definitely have some qualitative numbers around it, but when people come with their true self to work, are able to talk about their mental health, feel comfortable to speak about all the part of their lives, we consider it's also a great way of measuring the success of everything we're running. So thank you.
Brilliant. Thank you so much, Mathilde, Laura, Lisa, Greg. Bilge and Sunita, an hour packed full of information. We will send all of the links to everyone with the recording afterwards. We've case studies coming out every month from all of our members. The questions that we didn't get to in the Q&A, I'll follow up with you personally. So a huge thank you, everyone, for joining us today, and look after yourselves. And healthy people make a healthy business. So thank you very much for taking the time and energy to listen to us. Thank you, everyone.